legal dimensions of nursing practice. You need to know what is legal and what is illegal, especially in the state in which you are practicing nursing. Number one, you do need to know these concepts. Law is the standard rule and conduct enforced by government, how you need to act and behave yourselves in public, okay? There is public law, there's private law, and then there's also criminal law. Make sure you do, yes, you do need to know private law regulates the relationship amongst people. Criminal law is what you do in terms of messing with the feds, okay? Like murder, theft, and stuff like that. And why you need to know it is because, yes, as members of society, you're not out jabbing a knife into somebody's heart, but you could be fined like a felony, like murder or whatever, if you provide negligence or poor harm. In other words, giving medication you ain't supposed to be giving. They could charge you as a murderer.
Like that one girl.
One girl.
Oh yeah, we saw it.
I don't know. Tell me about it. Spill the tea.
Accidentally gave the wrong drug and it like killed
She
the
pulled
patient.
a wrong med out of
Out of the Pyxis system?
Yeah.
It started with a B and she pulled a generic.
I think it like
back instead of
it like paralyzed her and she like suffocated.
Why the patient went into an MRI.
Oh, Versed?
Yeah.
Versed.
Oh,
She had to
so
give
she
a
wasn't
sedative.
supposed to give Versed?
No.
She pulled Versed instead of another medication.
She had to sedate her so she could be like calm for the
For
MRI.
an MRI,
Yeah, they give Versed.
Yeah, it was
Zirconium.
yeah,
She pulled
zirconium.
Oh!
Yeah, so now she lives on a farm.
Yeah.
Damn.
It's crazy.
But everything about it, everybody
like
was messed up.
She was from Vanderbilt too.
And she was teaching another nurse.
Yeah, she was
and
teaching.
they like tried her for like murder, but like
yeah, but the hospital tried to cover it up too. Like the
Yeah.
hospital
Yes.
made the mistake of putting that drug in the wrong place in the
No,
fix.
Which
The pharmacy,
She
yeah.
was able to
She
override.
kept saying, she kept
No, but it was
saying
supposed
B,
to
but
be
first
like
it wouldn't come up.
much
So when she
further
said
down.
zirconium, she
It
was
wasn't
kinda
supposed to be.
like,
Oh, no, that's when you call pharmacy.
Yeah.
Guys, let me tell y'all, that will happen, and let me not be so absolute, but it is very likely to happen in real life. Number one, to err is human. This is why you check, recheck, quadruple check, especially when you're giving medications. Like, even if you're used to giving those medications, you need to check and recheck, because that's your license on the line, right? So she was able, from what y'all telling me, she couldn't pull out Versed, but she could override the V, and she gave zirconium. Listen, when
And
you
they
cannot,
didn't scan it.
and she did, oh
Yeah,
yeah,
she
she's
did.
in trouble. Okay, I'm sorry.
She didn't.
You cooked.
You put it in her pocket instead of like her little thing. She did roll. She walked down there.
Yeah.
Yeah, she was busy as heck.
She was a newer nurse.
1
Yeah,
year.
2
Oh,
years.
this,
Yeah.
yes.
Yeah.
Okay, you could get tried for murder.
She wasn't her patient.
It wasn't her patient.
No,
It was one of the floors that were short.
Yeah.
Yeah.
So there's a lot
Patient
of
wasn't on monitor.
We're not far
It was
enough.
so much.
Yeah, patient had the monitor.
Yeah, they're giving the patient a paramedic.
Now, this is where risk management is going to now come into play and look at how they can fix that system. They're gonna look at the patient ratio. They're gonna look at, okay, why was she even involved in the patient's case in the first place? How could they make it better, etc. She got fired and she lost her license.
Oh, yes,
Well,
yes.
they
Yeah,
tried
And they charged her for murder,
Yeah, she got manslaughter, I believe.
manslaughter, yeah.
But they didn't give her like time. I think she did maybe a year.
Yeah, but that license, I don't think she'll be able
No,
to
I'll never
practice.
get a license back.
No,
ever.
she didn't.
didn't.
Imagine going through all that you went through Dr. Semi's class.
Sullivan.
And Sullivan to go through all that
Just
to have it snatched away from you. Guys, you have to be very careful. Okay, just be careful. And I'll rest my case with this. You see how you could be tried? This is why it's very important. Now, also, too, you need to know what's in your scope of practice. What is it that you are allowed to do within the state that you are actively practicing as a nurse as? Because if you're doing anything outside of that, you are going to be in trouble. Even if you watch Grey's Anatomy 10,000 times and feel like you could still do it, don't do it. Is that understood? Okay? Very important. Now, moving forward, you do need to know this. Sources of the law. Where does the law come from? There is constitutions, which basically guide the legislative body. Statutory law, which is, again, enacted by the legislative body. And then you have administrative law, which is basically, these are the executives, the power-ups that we like to call them. They're the ones making decisions as well, telling us what it is that we can and cannot do. And then there's also common law, which is judiciary systems, basically, that reconciles any controversies that can happen as a result of, at the level of common law. Yes, I want you to know the court system. Do I want you to ever have to deal with these issues? No, but you need to know it is a possibility, okay? Litigation. This is when somebody wants to bring on a lawsuit, okay? You have the plaintiff, the one who's complaining. Just think of the one who's complaining, that's the plaintiff who's bringing on the complaint, all right, or bringing on the suit. And then you have the defendant, the one who has to defend themselves against this lawsuit. You are presumed innocent until proven otherwise. Always remember that. The individual, the defendant, is always presumed innocent until proven otherwise. And sometimes it feels the opposite way. Just letting you know. Why do I want you to know this? Because you may find yourself in this situation where a patient was not happy about the care received or whatnot, and you did everything within your means, but yet they still want to bring on a lawsuit against you, and you have to remember what it is that you did, what it is that you didn't do, etc., to defend yourself. Okay, I've been put on the hot seat before. I remember, I'll never forget, I had a client. This is when I started working. This is in the era where I worked, where they gave me 8 patients or 9 patients. Yeah, that's crazy. Okay, and once they gave me 10, but whatever. I thought it was legal. Okay.
I was just a baby.
I was just a baby, okay? However, this client would not want to go to any other facility except, at the time it was known, I don't know if I could tell the hospital. Let me not tell the hospital name. No, I want to be in trouble, okay? Now, this client was on certain medications called, let's just say anticoagulants, which basically can put their blood coagulation levels off, okay? They were actually on the C one, but it is the other generic. Okay. Now, the first day I had this client, I gave the medication. The second day I had because the INR, the ranges it was within therapeutic range. The second day, however, when I got the client, I looked at the therapeutic range. I'm like, oh no, can't get this. Okay, did not give it. Patient's blood pressure started going high. Okay, call the physician. I'm like, listen, doc, I need something because the blood pressure keeps going high. She has nothing for blood pressure. Physician gave me the PRN medication. Okay, boom, second day, we cool. Third day, I had the client. The INR was much higher. I'm like, damn, why is that higher? I didn't give it was, and that meant, I remember she was on that anticoagulant once a day. And I'm like, damn, the INR is still high, okay? And the blood pressure was high. It was constantly getting high. Okay, so I did not give the INR, the anticoagulant. I gave the first dose when the blood pressure was high. I gave it that one time. My assistant did not tell me at 12 o'clock that the blood pressure went up to I think it was close to 200, not 200, but it was significantly high. Right. But I didn't find this out until 6 p.m. So this client went 4 hours without. That was problem number 1. Remember, mind you, I had 7 other patients. Okay? Not that it's an excuse. Boom. While in the midst of that, the daughter comes in. I'll never forget. The daughter says, listen, my mom's saying she can't see. I'm like, huh? I dropped everything. I said, what do you mean she can't see? Go in, do a neuro assessment. The eye is glassy. Glassy. I'm like, I'm doing this. Now my neuro assessment looking like this, come back like I'm a crazy. I'm like, how many fingers do you see? Can you follow my hand? She couldn't do it. Call the physician. Now I'm worried. Physician, you know what he ordered? Ophthalmologist. I said, what? I mean, even as a new grad, I know that's cray-cray. I said, this is an acute change. An ophthalmologist, first of all, they ain't gonna come to the next day, number one, and this is an immediate situation. I'm like, listen, so I'm worried about the eye change, the changes in the vision. I said, okay, boom. Call my charge nurse. I said, listen, this is what's going on. I don't agree with this order. I told the physician, can we do something stronger than just an eye ophthalmologist? Physician refused. And to make it worse, he was covering. The physician that I ended up speaking to was covering for the primary physician, okay? But that's neither here nor there. So then I said, listen, we need more than an ophthalmologist. Can you recommend, can we do something more aggressive than this? He's like, no, that's all I want. I told my charge nurse, listen, I told even my nurse supervisor, I was documenting, which we'll talk about in a little bit. I was documenting everything. Everybody I talked to, I documented. And then I said, listen, it's going late. You know, forget my other 6 patients. This is my critical patient. I had to call the nursing supervisor. I said, I've been on this for the past 5 hours. All I got was a mere ophthalmologist. We need more than this. And now she's changing. There's a significant change in her status. Nursing supervisor, I'll never forget him, the bomb. He said, he went and did his assessment. He said, I agree with your assessment. Let's get an intensivist. Get the intensivist. Intensivist, like, how long has this been going on? I said, for the past 5 hours. Surgery right away. To make a long story even longer, they went down the surgery, cut open her head, called the daughter and said, we need to make this client DNR. Oh, she had a massive brain bleed that could have been taken care of
5 hours.
Yes. Boom. How did I get almost to here? Daughter wants to sue because mommy was fine. Daughter is absolutely correct. Who they want to put on trial?
You?
Me.
What?
Yes.
Oh my God.
Even though you were the one advocating
on her behalf
the whole time?
because I didn't get 1 dose of the blood pressure medication on time. It was my fault. You see what documentation? Thank God for great supervisors. Number 1. My supervisor said, listen, you're going to go in there, you're going to sit down, and you're going to shut up. I was like, say less. Say less. Of course. Don't say nothing. Because they saw my documentation, which we're talking about, everything that I did, and I am really not the one who's always on top of documentation, but that day I had to be. Right? And
God
that's what saved me. You document everything. Doctor said call ophthalmologist. Called again. Doctor said this. Doctor said don't call him again. Doctor said call supervisor made aware. Charge nurse. Everybody who was made aware was on that, even though that's not the proper. That's what saved me. That's what saved me. Okay? I was a defendant, but I didn't go to an actual court. But I was on trial in the facility's little court. I call it a little court system. That's when I knew, ooh, they do have a little system going on because it was going to end up going that way. I can tell y'all more stories galore, but
did the doctor end up getting in trouble?
Huh?
Did anybody end up getting
the physician?
Good.
The physician. Yeah.
I mean, not good.
No. Well, I say good because the trouble that I felt like they should have got in, they didn't get in. But that's politics. But anywho, we keep it moving. But you may find yourself in an actual court system. Because I almost found myself in an actual court system. But when you get to that case, to that part, you need to know once they say, yes, there is a suit in place, you need to know who to talk to and who not to talk to. Kenosha and Chanel, they best of friends. And Chanel is in the hot seat. Chanel cannot tell Kenosha nothing. Even though both of them may be in the hot seat, Kenosha cannot talk to Chanel. Or vice versa. You understand? The only person, once you're in that predicament, that the defendant can talk to is the lawyer.
So, let's say you're talking to your lawyer on the phone and Kenosha happens to be there. You're
Bruh.
not really talking to her.
No, but she just happened to be able to listen, bro. How convenient was that? Alright, so again, you should know this, but I'm not going to test you on these. The Nursing and Legal Regulations of Nursing Practice Acts is very important for you to know, credentialing, etc., and certification. Reasons for why you can end up having your license revoked. You must know this, and I will put a push notes too. These are several reasons why you could get all that hard work, sleepless nights, hearing Dr. Semi yell at y'all every day, and then to lose it. These are some of the reasons where it's not limited to this list here, but these are some of the reasons. Fraud. And fraud, let me tell you, fraud is not just simply, I said that this was purple instead of blue, like false documentation. That's also fraud. You could also get in trouble. And some facilities are so strict, they will send your name to the board, even if something that could seem so minute. Does that make sense? So you got to be very careful. Deceptive practice, criminal acts, gross or ordinary negligence, okay, or physical or mental impairment. Now there are situations where a nurse has had mental impairment. They temporarily lose their license, but once they to get their license reinstated, they would just have to go back to the Board of Nursing and prove that they are capable or fit to practice. Okay.
If you let your license lapse, do you have to take the exam again?
You don't, but you pay a high fee, if I'm not mistaken. And I think that's dependent on the state. So,
like for Florida, because the license only lasts 2 years, and then you have to pay for the.
I know for sure if you let it go, you let it expire, your fee, because I know from experience, I be waiting until the very last minute and forget, and then I have to pay higher fee. I know that for sure, but I don't know how long you can allow it to last before they require something more invasive.
Schooling or
I think it's state specific, but I don't know. That's a good question though.
What did you put as physical impairments?
Physical disability. Yeah.
Completely paralyzed or
yeah.
I lose a limb, do you now lose your license?
No, you don't lose your license. What ends up happening is now you're limited into working in certain facilities, or certain units. They just might have to change your job, or when I say job, you're no longer providing patient care, but maybe you're doing some administrative work or something like that. Okay? But paralysis could cause you to it's rare. I don't see it happening, paralysis, for example, being a reason for having your license suspended. Somebody has to really be a jerk. And I know I'm on live, but for you to take it that far, or whatnot, you could just go work for somewhere else, but you don't have to lose your license. Anton?
I know some facilities consider stuff like that as a disability. When you're gonna get a job there, they list out like you said, something with your leg. They count that as a disability.
Yeah.
So.
Because of the type of care you have to provide. So, for example, if my upper extremities are not working, how am I going to start an IV? How am I going to turn a patient? How am I going to be able to provide certain care? You understand? So that's why. They just may not hire you. And they do ask you on the application when you're applying for a job, if you're able to perform those functions. Okay? This one right here, don't play with me. For sure it will come up. Criminal law, crime, basically is the wrong done against another person, from one person to another. Now, there's levels to it, where it's a misdemeanor, where you get less than a year of imprisonment, or you just be in prison for less than a year, or a felony, where you are in prison for more than a year. Okay? Now, this right here comes up a lot in the NCLEX questions. Tort. The wrong committed by a person against another person or that person's property. Okay? You must know in terms of tort, there is intentional tort versus unintentional. And you can see it in the name itself. Intentional, I did that on purpose. I purposely pushed her. Okay? That's intentional. Okay? unintentionally, I did the mistake, but I committed the act, but I didn't do it on purpose, but it's still a tort. Does that make sense? In the book, what are some examples of unintentional tort? Huh? Not assault. I was gonna say assault. I was about to say. Okay, what's Jack is like, I just wanted to say an answer. Unintentional. Kenosha right there. What do you mean at me? The answer not on my forehead.
Negligence. I was thinking.
No,
an example.
It's right there. Why y'all be looking all over the world for the answers? It's right in front of you. Huh?
Watch out.
Negligence, and what's the other one?
Students
Malpractice. Okay. Anybody know what's the difference between those two? Because I don't know what the difference between negligence and malpractice is. Go ahead, ChatGPT. Look at him go. Go ahead, ChatGPT it. What does the book say is negligence? While Anton ChatGPT that answer.
Defined as performing an act that a reasonably prudent person under similar circumstances would not do.
That's what?
Negligence.
Negligence.
And what is malpractice?
The term generally used to describe negligence by professional personnel.
So negligence is
Failing to follow standards of
No
care.
technique.
So negligence is general carelessness and malpractice is professional carelessness in healthcare or by a licensed professional.
So if I ask you what's the main difference between negligence and malpractice?
Professional. Licensed.
Professional and licensed, what are that? So for example, if a surgeon goes in and cuts up somebody and leaves the sponge in the body cavity, that is what, negligence or malpractice?
Malpractice.
Or negligence.
Negligence can lead to malpractice.
See, now
Negligence is a general term.
Uh-huh.
Malpractice is specific type profession. It's a specific type of professional negligence, usually referring to misconduct by a licensed professional who violates the standards of their field.
Okay, English, plain on English. What was that? You read that so nicely to us.
I did.
Yeah.
I mean, the book says negligence is defined as performing an act that a reasonably prudent person under similar circumstances would not do. Conversely, failing to perform an act that a reasonably prudent person under similar circumstances would do. So basically saying something that someone would not normally do, they're doing.
Mm-hmm.
So,
or something that they should be doing and not doing.
They should be checking to make sure all of the towels are out of the patient's abdomen, but they didn't, or they didn't recount, or they miscounted, but they didn't do it. It's almost like seemingly one is, and then, so it's like kind of the intentional or unintentional missing of a step almost, or wait, I don't know. And then malpractice is
professional negligence.
So what's the main difference? It's a professional mistake.
Ignoring known risk.
Huh?
Ignoring known risk is more malpractice.
Ignoring known risk. Okay, yeah, which is go back to Kiani's example. So the main difference is basically is done by a professional. Yes. That's the main. I've been looking up and down to see if there's anything
anybody
specific.
can be negligent, but not everybody can commit malpractice. Is that
Yes.
what you mean?
It's just malpractice is just, if you notice practice is just specific to professionals.
Mm-hmm. So, nurses are considered professionals, but in the book it says that a nurse who fails to initiate proper precautions to prevent harm, like falls or skin breakdown, is subject to a charge of negligence.
Yeah, I know. I know.
Wait, what?
Yeah.
I hope you don't know this for the difference.
No. God, I don't want you to get so tied up on the semantics, so to speak, of this. The way I see it, and I could be wrong, but this is the way I see it. Malpractice is just a term for the professionals, specific for the professionals. Specific. Whereas negligence, anybody can commit negligence.
Yeah, like you could be a negligent mom, a negligent friend.
And you could be a negligent nurse.
Yeah.
A negligent care provider. It's just, I think it's just an umbrella for malpractice. It's just a negligence committed by the professional. That's how I see it. I don't know. I can't do anything wrong with anything else with that. Now, intentional, and notice negligence or malpractice, that's unintentional. You shouldn't do it on purpose, okay? Intentional, you doing it on purpose. And what are some examples of intentional tort? Battery, what else? Assault. What is the difference now between assault and battery?
One is verbal.
One is verbal.
No, that's not the
No.
difference.
Assault and
The
battery,
body
assault and battery is actually beating somebody. Or wait, no, that's
It says
Well, maybe.
It says assault is a threat or an attempt to make bodily contact with another person without their consent, whereas battery is an assault that is carried out and includes willful, angry, and violent or negligent touching of another person's body or clothes.
Basically meaning what? Because you have to know the difference. You can't tell me assault is verbal and battery is
So
nonverbal.
assault is I'm threatening to hurt you.
Yes.
Assault is I'm threatening to punch you. Battery is
Punching
actually
you.
trying to punch
All right.
you.
Hey, little girl with the red hair or orange hair with the crows. I'm gonna beat you up.
That's assault.
That's what?
That's assault.
Okay. Not her recording that. Okay. Excuse me. Excuse me. Excuse me. Yo.
That's battery.
No, she hasn't touched her.
I didn't touch her.
But you're trying to. No.
She's like
It's only when you touch her. Battery's when you
Okay.
touch
What did
her.
it say? This is why I want to make sure y'all understand, because y'all gonna do the same thing to me.
Being carried out.
She's basically threatening
When
her
I
body.
do, look, you see, look, no, sorry, I'm in the mode. No, I can't. Look, you see, look. Hey, that is
Assault.
So
watch. What videotape me?
Okay.
so they can't say shit.
Now look.
I say yell.
What is that?
Battery.
Why is that battery?
You
But I didn't
touched
do
her.
that. I didn't hurt her.
Because you
Huh?
touched her.
But you touched her.
And now you're.
No. Forget the what I did before. But I just did this.
You touched her without her consent.
Thank you. Okay. I'm gonna give y'all.
Yes.
Stacy. Okay. Stacy, you have a patient whose blood sugar is 600. Okay, normal is 70 to 120. But their sugar is 600. Client is awake, alert, oriented times 5. But sugar is 600. And you know what to do for that sugar. That is 600. What should you do? Give insulin. Okay. Boom. You come. And you're like, sir, your sugar is 600. I'm here to give you your insulin. Patient refuses that insulin. They refuse the insulin, but this to you is a life-saving measure because you know if that sugar keep going higher and higher, they can either stroke out or die or croak out. Okay, no, I shouldn't say that. But okay, boom. But patient refuse, and you go ahead and get that insulin anyway. You save the patient's life.
But that's battery.
But wait a minute, she saved the patient's life.
She did it without
It's
their
not
consent.
consensual.
It don't matter.
You could. Wait, hold on. What would you do? What?
Would you consult the doctor first?
It's documented.
Oh. You hear Stacey's question? Would you consult the doctor first and then do it?
If they.
They refuse.
I'm documented.
You are simply, what should she do in that situation? Cornelius. Huh? I mean,
I was the supervisor.
the ethics committee gonna look at you like, why you, I put that as an answer choice. Who should you contact? Ethics committee. No.
Write it down.
What is the appropriate response to that?
Report to doctor.
Check the
Huh?
informed consent.
Report to the doctor, and what else should she could do?
Write it down.
Just document. Patient refused. That's it. Okay?
Will reject.
Huh? Say it again.
And educate.
And educate. You always provide education.
So you tell the patient, hey, stupid head, you're gonna die.
Okay?
I wouldn't insult them.
No. Say it again. What did she say?
I said, so you wouldn't say, hey, stupid, you're gonna die if you don't take this insulin. Because that would be assault.
That's a real thing. You know that's a real thing.
That's what I'm saying. You wouldn't do that.
You
Correct?
shouldn't. You better not. That's not compassionate care. The Cornelius is Cornelius. Listen, if you say to the patient, listen, you better take this insulin or else. What is that? Assault. That is assault.
And if you give it,
And it's assault and battery. Listen, you better take this insulin because you ain't gonna die with my watch. I got time. Tell mine. Okay, I gotta be out here. Okay? That's assault, that's battery. Even though you're doing beneficence in your mind.
See, but then if they die, can't you be like what happened to you? They can
No,
try and
because I documented patient refused.
But you documented everything that was happening. They still tried to try you.
Well, that's like if a patient.
That's because they try to find blame. That's different.
That's what I'm saying. The
Yes.
family's gonna try and find. Why did
No.
my dad clearly wasn't in his right mind? Why would you
no,
listen
still,
to him?
she was awake, alert,
We're gonna
oriented.
sue your hospital because you let my dad. So it's like.
Yes. Of course. You definitely do call the physician, notify the physician. You do need to document, and that's part of your documentation. You educated the patient, listen, the insulin, your sugar is critically high, and this is what happened. This is what could potentially happen if you don't take care of it. One of the best ways to take care of it is to give this insulin so you can say, quickly bring it low because you are at risk for stroke, you are at risk for this, you are at risk for the other. And then patient can still continue to refuse. Notify the charge nurse, sure. Definitely notify the physician. Okay? You don't document charge nurse notified. No, charge nurse is not the one that's gonna. They should be made aware because they're in charge of the entire unit, yes. But you need to document that you notified the physician. Okay? Now, if the physician says, because I'm going to try to say this. What if the physician says, okay, hold him down, restrain him, and then give the insulin? What do you do in that case? Because some physicians could try you like that.
I'm not doing that. You can come here and do that.
But the patients now, it went from 600 to 650.
Supervisor.
Huh?
Get a supervisor.
Get a supervisor. Okay, charge nurse, everybody else is going to be involved. And you need to also educate the physician, that's restraint. Okay, and that's non-ethical. That is a form of battery because now I'm going to touch him without his permission. And you are going to get in trouble, not the physician who told you to do that. Okay, as long as that patient is awake, alert, and oriented times 3, 4, 5, whatever, if they don't want you touching them, even if it's for life-saving measures, you are not to touch that client. Is that understood? Unless you want your license revoked. Or go work on the farm, what it was? Okay, all right, so that's assault and battery. What's the other ones that falls under intentional? Defamation of character. Give me an example, Kenosha, of defamation of character. And while Mason tries to validate your answer by looking in the book. Bro, defamation of defame.
Oh, yeah,
Stupid.
Huh?
The Keanu example, right?
Oh, yeah. Stupid. If you don't take your medication, you're going to die.
No, that's not defamation of character.
Saying that she's a bad nurse and she can't do her job correctly.
Yes. You're defaming the person. Huh?
What if it's reputation?
Yes. What about the reputation?
That you're making derogatory.
You're making Hold on. You see what Keanu said? Oh God, I gotta look at her documentation. She said,
What if I actually am a terrible nurse who?
That ain't. But that's not what documentation is for.
I'm not saying that. I'm saying if the defamation is true, is it still defamation?
Then no, it's not defamation. But what are you saying? Like if you're going to say if Kenosha comes, let's give a real clinical example. Kenosha, I gave report to Kenosha because, it's time for me to go. When Kenosha looks at my work, she's like, well, damn. she said she did the dressing. I mean, I see that it's changed, but it's not changed to her standards. Instead of Kenosha just saying that dressing is dry and intact, Kenosha goes and document previous nurse, Judith, is incompetent, does not know how to do proper dressing change, and she is a poor caregiver. That's defamation of character.
Yes, but my question is yes, that's defamation.
Mm-hmm.
What if it's true?
Then that's not defamation.
It's not your job.
Because is it still my question?
Hold on,
is
wait
it
a
still
minute. I need to know if are you telling the truth or are you telling your opinion?
No, like if it's say you weren't necessarily saying it like that. You're not saying like, oh, Judith is a terrible nurse, but you're like, the dressing change was not properly done by the previous nurse. You're not putting names, but you're kind of like, dressing was not properly changed or was not changed at all or da-da-da, whatever. Would that still be considered
No, that's proper documentation.
That's proper documentation.
Okay, that's what I was asking.
Yeah, you could say dressing found in this condition, soiled, purulent, da-da-da, or whatnot, and hanging off by a thread. That's what you found. That's your assessment.
Okay.
Completely different. But when you go and say, oh,
it was Judith,
who didn't properly, when the patient clearly was probably soiled because either the wound is getting worse, or the patient was fiddling with the wound, the dressing. You didn't bother to gather that data, but then you go and say, oh, Judith is a poor nurse because she didn't properly keep the dressing intact. That's defamation of my character. And I'm coming for you. No, let me stop. All right, Cornelius.
In a real life setting, though, if you truly have a concern like that, wouldn't you just discuss that with the supervisor in private?
You can, yes, because the nurse probably is gone, number one. But also, you do need to. This is why this is going to get a little off topic. This is why proper rounding, bedside rounding, is very important. Because if you did your rounding while getting report, you would have seen the condition of that dressing. And also, a lot of nurses like to assume a wound, a dressing, let me not say the wound, the dressing is discombobulated because the nurse did poorly when they don't even consider other factors like the patient fiddling with the wound. Mm-hmm. They're going to go ahead and blame the other nurse. Because now I got to take care of this. I wasn't planning on taking care of this dressing today.
I've seen a patient reach back and pull off, like for their pressure ulcer, like reach back, pull it off, and scratch inside.
The wound, yeah. Oh, yes.
And then just try and just close it back up. And like saw it with my own two eyes and was like, 1, ew, 2, how, 3, ouch.
Yeah, all those words.
Like it looks like it hurts. It looks.
Now that should have been brought to the nurse's attention because it's an itch, and then the nurse would know to give them some Benadryl or something, you know. But again,
I was like,
there you go, defamation of character. What's another unintentional? This all in there. We going through them. What's another unintentional? I'm sorry, intentional. What's another intentional? Invasion of privacy. Alejandro, habla conmigo.
Go.
What that mean?
Conmigo.
Oh, that's a new one for me. Conmigo.
With me.
What? Oh, okay. With me. Habla conmigo. I gotta keep that. What does that mean, invasion of privacy?
Like, it goes like, I feel like it goes intertwined with having a person's integrity. Like, say you want to perform a procedure or something on the perineal area or something, and the patient's like, no, you can't, or whatever, and you still do it. Like, would that be kind of like a invasion of privacy?
I mean, you still go and do the priority of care?
Yeah.
Bro, that's battery right now.
What is it?
Yeah, okay. I mean, you gonna give and you might be doing more with this battery at that point too.
Just go with like HIPAA, like not disclosing the patient's personal information.
Okay, that's one. Yes, Cornelius.
No, I have a question following up on this. I don't know if anybody else has taken a test for the HCA, like healthcare, whatever thing. Okay, like one of the questions on there is what information can you and can you not disclose about a patient? And one of the things that it says that you're allowed to disclose is tattoos and other identifying markers.
Yeah, and it says you can
Like
do
you can talk about their
the
scars
year
and their
of birth.
tattoos and their year of birth.
To whom?
You can disclose that to anybody, not
Yeah,
to
that it's
the,
not
like
part
that
of
is not
HIPAA.
part of HIPAA.
Because
Really?
technically,
Yeah,
That's like
it's
in
part
the
of the
test.
test.
I got it
wrong.
wrong,
Yeah. Me too.
Really?
maybe
Yeah.
it's because technically, like anybody
If
could
you're
have a
happy,
similar
you're
or
not.
same tattoo.
I have to look that up. No, like some
Because date of birth
tattoos
is
are marked. It's like a.
It's an identifying mark. Someone has a giant cross on their chest. You only got one patient that has a giant cross on their chest. Like,
I'm gonna look that one
Yeah,
up.
like this guy with the neck tattoos. Like it's very obvious anybody walking by can see the guy with the neck tattoos.
In our
Right?
school?
That was born in 1968. Like,
Yeah.
yeah, like the guy with the neck
Wow.
tattoos was born in 1968. You know, but that's what's like crazy to me.
Really? What were the other options? Was it multiple choice?
It was a multiple select, but it was
yeah.
like I mean that you can't give the vehicle identification number to their car,
Yeah,
their
their-
license
you
plate
couldn't
number.
get
You
their
can't do any of
license
that kind of
plate
stuff.
number,
But
As
you can
if you
tell.
would know
Or
that
their mother's
information
maiden
as their
name.
Like it's a very
Yeah,
odd.
just give
It's a
you
very weird
Shayla's
question.
VIN
It's like
number.
they're
It's for authorities like FBI.
Oh, I don't know. That's a new one for me.
To work there.
Okay,
yeah.
I'm gonna look that one up. All
I'm
right.
trying to get the document for you, but it just.
I would like to see that one. I would look that up. Okay, defamation of character, invasion of privacy, divulging information like we talked about to other people using the example we gave earlier. What's another unintentional? I mean, not intentional.
False imprisonment.
False imprisonment. What is false imprisonment?
The unjustified retention or prevention of the movement of another
What
person.
example do you see that they give you?
Restrainment.
Oh.
Ooh, putting those bedsides up when they don't need them up.
When they don't need them, okay. And how many side rows have to be up for it to be considered restraint? All four. Now, you must know, and we're going to talk about it again, or I'll bring it up again when we talk about safety. There is only one situation when all four restraints are up, it is not considered a restraint. The situation must be that, first of all, that's what the patient wants. If the patient says, listen, I have a fear of height, and yet the bed is in its lowest position, but they want all four up, that's a factor. The patient has to be able to have the consent, has to say that that's what they want. In addition to saying that's what they want, the patient has to demonstrate to you that they can safely manipulate those side rows. Because restraint is basically allowing freedom of movement of all body limbs. And when you put all four limbs up, their movement is now being restricted, right? So if the patient can demonstrate that, oh yeah, I can safely put the bed rail up and down, and they've demonstrated that well to you, then okay, all four side rows, hold on, I see your hand, all four side rows being up is no longer considered a restraint. And you better make sure you document that. All four side rows are up. Patient wants all four side rows up. Patient has been educated on the use of the side rows, and they were able to successfully demonstrate that. At that point, it is no longer considered a restraint. Are we clear?
Yes.
Okay? Yes.
Well, my question is, doing all of those things, I've actually still gotten in trouble for it. Putting those side rows up because, I had a fully ambulatory patient. They could walk and move and do everything. They were fairly young. They were just in a nursing home because they didn't have anywhere to live, honestly. But he liked his side rails to be up. He knew how to put them down. Documentation was in his chart, literally part of his care plan or something, patient when you finish helping them clean themselves up and then move back to bed. It was in there already. And I still constantly got in trouble and actually almost got written up once until she wasn't my supervisor, but she was someone else who dealt with him constantly. She was no, that's the patient, that's how he wants things, and that was the only reason I didn't get written up.
Let me ask you this. Who told you to put all four side rows up? The patient? Was that confirmed to you by the registered nurse?
Yes.
Okay.
Well, there was, I think the issue was there was multiple ins and outs, if that makes sense. There was RNs were constantly changing. So, it was.
But was it documented? Is it in the patient's document?
But it wasn't necessarily a great facility in that it was high turnover rate. So, the nurses, I think it ended up being one of the nurses ended up reporting me on not knowing, almost because she was still new, like not knowing that patient does prefer it to be that way.
But it should be in the documentation.
It was, and so
okay.
it was kind of a thing of like maybe she didn't check or maybe she didn't see her. I don't know, but I
was
almost
not
got written up
communicated to
for
her.
it because then my like big supervisor was like, "What are you doing?" So it was just a very like, so what do you like? What do you do?
Okay, first of all,
like
there's a lot of issues with that scenario. Number one, communication. This is where we talked about communication. So obviously somebody's not reading a chart, somebody's not constantly documenting, somebody's not the chain of command. If the patient preferred for all side rows up, the nurse is not the only person who's going to know that the all side rows need to be up. The charge nurse or the supervisors need to know
this
because
is a nursing home. So
no, it doesn't matter the facility. The chain of command, everybody needs, because ultimately supervisors are responsible for all the residents. It doesn't matter the facility. So there's a break or in the communication pattern, which is why when I talk to you about effective communication, there's things like that happen. So you would have been able to defend yourself in that case anyway, because if it's documented.
Well, I almost got written up. They were like sat me down in the office. They're like, "Hey, sign this form." I was like, "For what?" Legitimately, I was like, "Why am I?" No, they were like, basically sign off that you understand you're getting written up. I was like, "Why am I getting written up?"
See?
Because then it's like you get a certain amount of write-ups, and I was like, I've not been in trouble in like the year and a half so far that I've been working here. Why would I?
Documentation. This is where documentation can help you. All right. Safe invasion of privacy, defamation of character, false imprisonment. What else is fraud? What's fraud?
Willful and purposeful misrepresentation that could cause or has caused.
Let me show y'all. Give y'all a great example of fraud. What time is it?
11:02.
Did you say credit card? No. Oh, okay. It's 11:02. Medication's not due till 2 p.m. But I know I want to be somewhere at 2 p.m. And I, at 11 o'clock, documented that I gave the 2 o'clock medication. That is what? Fraud.
How do you document at 11 o'clock that you gave a 2 o'clock medicine?
Let me tell you something. There's so many ways to beat the system. There's a lot of ways to beat the system.
But
that is fraud.
Wouldn't it time that you made that documentation at 11 o'clock?
I'm just telling you, hey, it happens. That's fraud. You're going to get in trouble. Okay? Or documenting that you did the dressing when the only thing you did was change the label. When you... That is fraud. Okay? And you didn't even do the dressing change. The only thing you changed was the label, and you said you changed the date from what's today's date? What's it? 5/24? 5/26. Damn, 5/26. And you know you ain't changed it since 5/20.
Ew.
Okay, it happens. All of that is fraud. Okay? Are examples of fraud. What else is under intentional? Fraud, false imprisonment. We got everything. Invasion of privacy. Defamation of character. Don't play with me. Okay? You see, I spend my time on this one. Okay? Because I don't want no problems. Alright. Oh, this was right there. Okay. HIPAA. You cannot go through nursing school not knowing what HIPAA is. Please, I don't even need to stress this. Okay? HIPAA, making sure that only who is involved in the patient's immediate care has access to that patient's information. The patient themselves has the right to their own information. Please know that. A lot of facilities, for some reason, be like, nah, you can't get that. Right, but that's the claim. Get that patient their lab results or whatever, okay? Now, how they get the information, each facility is different, okay? Like, for example, some facilities, if the patient wants a copy of their lab results, it's okay for you to go ahead and print the copy of the lab results and hand it to the patient. Other facilities, the patient actually have to go downstairs to medical records and go through this whole hula hoop to get their information. And it's how they get the information is unit or facility specific, okay? All right, and also with regards to HIPAA, you need to also respect how the patient chooses to get the access to their information, whether it be by text, email, or written, or like a written document, etc. Okay. All right. Liability. Liability. I'm not going to test you on that. Duty, breach of duty, etc. Now, the common categories as it relates to malpractice claims, pretty much self-explanatory. You should know what are some categories, like failure to follow standard of care, failure to communicate, like what Kiani was giving an example of, failure to document. You did the work. You saved the patient's life, and you did everything you were supposed to do, but only thing you did not do was not document. And we all know there's a saying in healthcare: what's not documented is not done. If it didn't document, it didn't happen. Okay? You must know how to document, when to document, okay? And what to document. All right? Failure to act as a patient advocate. Patient is in pain, and you know that patient is in excruciating pain, but you're like, okay, they'll be all right with this Tylenol $650. You understand? When they need more, you're not advocating on it. It is your right, it is your duty as a nurse to advocate on behalf of your clients. And of course, failure to follow the chain of command, even in nursing, as nursing students. If you got an issue, for example, you go to your immediate supervisor, like at that point would be the charge nurse. If the issue is not resolved, to your satisfaction, you go above the charge nurse, which usually is like the unit manager or supervisor, depending on the facility, what name they give. Then you could go up, supervisor, manager, up to what? I think it was what? CNO, chief nursing officer, etc. Okay? So make sure you follow the chain of command. In each facility, they always, when you upon hire, they tell you what those chain of commands are. All right, you gotta follow that. Alrighty, potential outcomes of, okay, I don't need to spend time on this one. Now, this roles of a nurse, when it comes to legal proceedings, you must know the nurse can be a defendant because they might have to defend themselves. They can be as a fact witness and an expert witness. Now, I am going to ask you, what is the difference between a fact witness versus an expert witness? Cornelius?
So a fact witness is somebody that is just attesting to the facts. Like, yes, the dressing was changed at this time. I, saw them do that. Yes, I did witness the doctor, prescribed this drug. Yes, right.
So they were there.
Yeah.
Okay.
An expert witness would be. Oh, I'm sorry. Go ahead.
No, go ahead. No.
Expert witness, I think, would be somebody that is an expert on that specific subject.
Okay. All right. I like it. All right. They weren't there, but they know about this issue. We have Nurse Jackie. What type of nurse you gonna be? What type of nurse you gonna be?
Oh, sorry. I just brain farted because I was looking at expert. Yeah, CRNA.
CRNA.
Yeah. Sorry.
Okay. We got.
Don't worry, I know it for you.
No.
Jackie Bay. CRNA.
Just help me through that.
Just count. Yeah. Listen,
Lord.
I gotta get through Patho. You know what I mean?
Jackie B.
Yeah.
CRNA. And then we got. Let's just use me. Judith S. Who has
OG.
hold on. RN PhD. Boom.
She got all those initials.
All those initials. Too much to write. Alright? Let me add FA. Okay. CZP, CHEP, all these stuff that we nurses don't know what they mean. Okay, boom. Between Jackie B and Judith S, who would you choose as an expert nurse when there was an issue under in anesthesia? Jackie, you say?
I say you.
You say me. Okay, why you say me?
Because you have more expertise.
But she's a CRNA.
Because you have more expertise.
I have more expertise. Okay.
More experience.
More experience. Okay.
With said thing.
With said thing. Okay. All right.
She's a CRNA.
But she's a. So who would you say if there was
Jackie?
An issue
I would say Jackie.
during anesthesia, during an anesthesia procedure, She's not a fact witness, but she can serve as, you need to choose an expert witness for this situation.
Jackie.
Why?
She's an anesthesiologist nurse.
And not only that, she's
a
what?
specialist.
She's working there currently as well. So she's an expert in that domain. The degrees or the letters that follow your name doesn't make you an expert in that domain or as a choice. Even if let's say I was a CRNA. Let's say I do have CRNA behind my name. Okay? But I haven't been in the field for 20 years or 15 years, okay? But Jackie, she's been working there for the past 10 years.
Jackie.
Who is it?
Jackie.
Jackie, because she's currently updated with the changes, etc. So don't let these letters fool you. All right? Are we good?
Yes.
Okay? All right, Jackie, you see how important you are?
You can keep that up there because I like seeing it.
All right, we're going to keep it up there for Jackie, even though it took you a minute to get to that answer.
Every time someone says Nurse Jackie, I just think of like the lady who just like has drug problems. And
It's on
TV
Netflix.
show.
It's
I started watching it.
That's a perfect example of a great terrible nurse. She's a great
she knows her stuff. Yeah, she is.
She's a very good nurse, but a very terrible nurse.
Why does everyone know all these people?
All right, recommendation for the nurse as a defendant for the most part, make sure, like I said earlier, don't discuss with the case with whoever's not involved in it. Okay? Always speak to whom only? The lawyer or your attorney. Be courteous and don't volunteer any information. And this I know from experience. Like I remember when they tried to put me on an actual trial because a client was going to sue the facility, and I was working charge. And I remember a year and a half passed, and that's when they're saying, "Listen, we need to prep you because the patient has decided to file a lawsuit." And the lawyer was asking me questions because I was a charge nurse, even though I wasn't directly involved in the patient's case, but I was involved, sort of. Okay, the patient fell and broke their hip. And I don't have to document, but I usually like to document what I did. And then I remember like a year and a half later, the lawyer was asking me questions, and I was like, refer to my documentation because I don't remember a year. I'm not gonna make up information. I said, refer to my documentation. And she would ask other questions, refer to my documentation. Other questions, refer to my documentation. Other questions, refer to my documentation. To the point where the lawyer was like, "You want a job?" I'm like, "Sure, whatever." But yes, don't divulge voluntary information. And if you do not remember, you need to make sure you state that. Don't make up stuff. Okay? Anywho, that's that. All right, legal safeguards for nurses. They're pretty much self-explanatory. I'm not going to spend too much time on it, but yes, you will be tested on them. Thank you. Okay, patient education, contracts, informed consent. Let me talk a little bit about informed consent, because this seems to be a huge ongoing problem. When it comes, first of all, what is informed consent, Mason?
Like, you tell me, like, personally.
You who?
Like if the patient tells you
Tells you what?
consent or refusal, whatever you're asking for.
Okay, so what is
I'm telling
informed?
them I'm going to do a cath, and they're like no or yes.
Okay, what is informed? Because you giving me, so basically giving me what?
Permission.
Permission. This is a document, a legal document where where the patient, client has agreed to have said procedure done on them. It's a legal document. Now, again, you must remember, only the person performing the procedure is providing the education related to that procedure. Shayla has a patient that is going for open heart surgery. Who is supposed to give information related to how the procedure is going to take place and the medications that's going to be involved? Shayla? No, the surgeon. Anesthesia is going to come in and say, these are the medications that we're going to use. Okay? With regards to informed consent, the patient has been educated who it is that's going to do the procedure, what exactly the procedure is going to be done and how it's going to be done. The patient is also not coerced or forced to give permission for this procedure to be done.
What counts as coercion? Like if you're just like, if you're not, like if you're explaining something and you're just kind of like, I just had it in my head, but it just left. Like, what's the difference between coercion and
not coercion?
I guess.
What were you going to say, Cornelius?
No, I was just going to say probably coercing somebody is like someone forcing them to do it. Like saying like, if you don't do this, you're going to die. You have absolutely no other option than to do this or die.
But isn't that just well? It's
No, that's
not to say if so. Exclude the part where you say you have no other options but to do this or die. But you're informing them that hey, this is the best option for the best outcome.
Patient always has to be given alternatives. Always.
What if there are none? The only. What if the only alternative? Like for example, like you have a
there's always
4 cancer patient. They're terminal.
No,
there's
hold on.
Either hospice.
There's always an alternative. The alternative is if you do it, these are the benefits. You can only educate and say if you do it, these are the likely outcomes, and if you don't take these route. These are the likely outcomes. But like the example Cornelius gave was beautiful. Like if you don't do the surgery, you're gonna go 6 feet under.
Yeah, of course that would be.
Now on the flip side of that, you do have to educate the client, or not you, but the person performing the procedure must educate the client that if you do the surgery, there's a chance of you dying on the table.
If you don't, there's also.
But you don't want to force the client. In other words, like you have to do it.
Well, that's what I'm saying.
There's a difference between educating and forcing. You understand? If you, in other words, you say you have to do this procedure. If you don't do it, but you could just educate the client and say, listen, here's the likely outcomes. You have a 50% of surviving. There's according to the statistics, provide data. Okay. That's not coercion. Okay? When you're simply educating on the possible likely outcomes.
Providing information and like what, like you said, the outcome could
yes,
be,
what's the likely outcome?
That's informed consent, whereas
that's part of informed
consent. That's part of informed consent, whereas coercion would just be like using any type of force. or like
being paternalistic too.
Like trying to convince them could be that's coercion.
Yes, trying to. Well, because convincing, there's like a little gray area to convincing too. But I like the word forcing or being paternalistic, trying to make the decision for the client. Here's what we're going to do. Okay. We're going to, where you don't get the client's input. You understand? That's a part of it. You don't want that. The patient simply has to be educated. This is what you're dealing with. This is our treatment plan. And this is the likely outcome of the treatment plan. Here's some alternatives, and here are the likely outcome of those alternatives, because they have to be told the truth. So they're told, they're making permission, they're giving permission based on the education provided to that client for this specific situation and procedure. Does that make sense? That's hence the word informed. They were educated. Okay? Also, they have to not be under the influence of any substance. They can't be lit under alcohol. They cannot be drugged up. So it's not when the patient has been given Dilaudid or Percocet, and that's when you're gonna be like, yo, so let me get that signature. And the patient's like, you don't know, okay? You gonna get in trouble. All right? Also, the person they have to be of sound mind.
What if the only way to get them of sound mind is by medicating them? Not with Dilaudid, but like say like
no.
Well, like because like if someone's like going through like a mental health issue and you need to give them like an antipsychotic or antidepressant or something to get them kind of to a baseline where they can understand information, right?
Is
that different?
It's can be actually realistic.
That's what I'm saying.
I don't know how that, because the thing is, why I'm hesitant to even answer that question is because you got to look at the possible side effects of that medication too.
Able to be involved.
What most likely might happen? No, what most likely might happen is they might try to get the next of kin to make a decision, to help make a decision with that regard. There's case by case scenarios.
That's what I'm saying.
Yes.
So I don't want to involve that in this, but
no, but
my
I'm
point is,
saying
like,
they will look at case by case scenario, but most likely they might, if possible, it seems like the most feasible thing, like because some surgical procedures or some interventions are very delicate, right? So they might want to look at who's the next of kin to help make that decision. They will probably look at it that way, okay? But with regards to informed consent, people, the person who is performing the procedure is the one educating the client of the procedure. Don't play with me on these test questions. Don't play with me. If the nurse is the one providing blood transfusion, who's going to educate about the blood transfusion?
The nurse.
Alejandro, you trying to make sure we stay awake? All right. Then other legal safeguards, documentation, which I really want to get to, and then appropriate use of social media, which I already have talked about, okay? Don't play with me on these, okay? And there's more, which is pretty much self. Oh, the Good Samaritan law. That one I can't skip. The Good Samaritan law, because I will definitely throw this in one of these assessments, and a couple of them. Brianna, what's Good Samaritan law? It protects the nurses from
helping.
I'm falling on the floor.
Helping someone in time of need.
No. She's close.
No.
Trinity?
Like if you go, if somebody like collapses and you go and save them, it protects you from.
Where?
Outside,
Mhm.
outside of the hospital.
Outside of medical settings.
Okay. Good Samaritan. Yes, Anton.
Emergency situations.
Okay. Anton, what type of nurse you gonna be again?
Yeah, CR.
You know, whatever I excel in,
Okay.
whatever I'm best at.
It's gonna be a good.
Are you gonna be an ER nurse? You wanna be ER?
Yeah. Trauma.
Okay.
Yeah.
Trauma. See? Okay, trauma. No, I don't want trauma for you. What is it? Example. Okay. Well, I can actually do trauma.
Versatile.
You ER. Let me give you ER nurse. Okay? You're the ER nurse. And you and your friends, y'all go to Publix, right down here in Tradition, and a patient starts to seize. What do? Don't run.
Turn around and go to my car.
Alright? When you do what you're supposed to do, you can, as a registered nurse, you go ahead and you provide care, you make sure you turn the patient, protect their head, do everything you're supposed to do until help arrives, and then that's when you can leave. Boom. Good Samaritan law protects you. Because you ain't doing nothing wrong. But let's say, for example, the patient, while you were protecting the patient, there was cut themselves because there was a glass and you didn't even realize it, and they want to sue you because now they got a cut on their forehead and it's messing with their beauty, right? So now they want to sue you. Could the patient sue you? Yes or no?
No.
We are in America. Yes, they can sue you.
Oh.
They can sue you for even the people. I could sue Janaya for looking at me. Okay? Now, the outcome would not likely be in my favor. The judge will probably be upset with me for wasting his or her time, right? And Janaya will be like, damn, I got to stand in this court just for this. You understand?
So they can sue you, but you're protected by the Good Samaritan.
Exactly. Okay? Because Anton did what he was supposed to do. Boom. Now, Anton went down the park across from Publix. I don't know what that park is, okay? And he saw a patient who was in respiratory distress, him and his homeboy. So Anton want to show out to his boys. You know what I'm saying? Like, oh, let me show y'all a real nurse are in action, right? In action. Boom. And Anton's like, I watched enough Grey's Anatomy. You know? Let me just go ahead. The patient has difficulty breathing, and Anton goes and intubate.
Tracheotomy.
It does like like his own homemade tray. Say the patient life, because that's what he saw on Grey's Anatomy and Resident.
Not a doctor.
Hold on, but wait a minute. You not listen. Wait till I finish my story. Okay. He saved the patient life. It worked.
No.
It did work. Patient life is saved. And time thinking he gonna be like, yo, getting all this accolade. What comes to him is a lawsuit. Are you saved?
No.
But the Good Samaritan law, he protected the patient.
To protect basic life support. Not
There you go. Say it again. Out of scope. He practiced outside of his scope of practice.
What if he's not even an RN and he does it? Does that still mean he's practicing out of his scope of practice?
Okay, that's different. That's not Good Samaritan law is for healthcare providers.
Oh, it's only for healthcare providers?
It's for it's not. It ain't for every citizen. It ain't for every citizen. Okay.
There's other laws for regular citizens.
Yeah, there's other law, but Good Samaritan law is for healthcare providers. But you have to make sure the care that you provide outside of the clinical or the facility, okay, clinical setting, is within your scope of practice. Now, also, what you could be in trouble though too, because if let's say for example the patient needed an IV, and Anton happened to have an IV start kit and a bag of normal saline.
Just on him.
It was in his car. He just happened to have it, you know. Yeah, he forgot about it, you know. Because us nurses, we're known for that. Not only is our pockets filled with pins, it got flushes, it got bandages, it got, a whole bunch of stuff that we just forgot to put back, okay? But he saved the patient's life. Now, it's in his scope of practice to start an IV. Would he be in trouble or would he be covered by the Good Samaritan law for that care?
No.
Why not?
Because all that extra tools and stuff from the hospital.
Yeah,
what you doing with an IV start kit in the first place?
Yes.
That is theft. Okay, yes.
What if the person is like one of those travel nurses that has like the IV kits that they come to your home and
that's different.
Okay.
That's different. It has to be something within your scope of immediate practice too.
Okay.
Like I should not be a med-surg nurse walking around with normal saline and 20 gauge, 18 gauge IVs getting ready to poke people. Be able to start a trach care, okay? So again, be careful. Make sure you know what the Good Samaritan law covers, okay? In addition to all these other legal safeguards, okay? All right, don't play with me. And then make sure y'all know your student liability. All right. These are the elements of informed consent that I already talked about. Don't play with me. Risk management program, you should know this, but I honestly don't remember having a test question on that. Incident report. Oh, remember I said what's not documented is not what?
Done.
What? Wake up! What's not documented is not what?
Done.
What's not documented is not what?
Done.
What's not documented? There is one thing that you will always do, but you will never ever document that you did it in the patient's chart. This right here.
Incident reports?
Yes. Don't play with me.